Elizabeth, I feel like you must sit there and feel like I told you so. I mean, I ask some of these questions like, how could it be that threat data gets distorted or doesn't make it to the White House when it's about terror threat, domestic terror threats, when it's about the Russia threat, when it's about the threat of white supremacy? And shame on me that I thought maybe the health of our children would be different. And so I feel like I already know what you're going to say, that everything is in service of his political goals. But it is still shocking to hear Olivia Troy, another person who worked in the Trump administration, who has come out like yourself and bravely is talking about what it's really like. I want to hear you on both how there is nothing that is beyond the reach of his political contamination. But I want to play some of her interview today with my colleague Andrea Mitchell.
This is just actually one example of that type of situation where we were tasked internally to find additional data that played more in favor of the narrative of what the senior politicals in the White House and the president wanted to relay. And in this specific instance, this had to do with finding data that was displayed in a certain way that showed that perhaps people under the age of 18 were less susceptible to COVID, or were less likely at risk. It's something that has weighed on me still today, because this is one of the most egregious things that I saw happen firsthand. And as a career national security professional, that is just something that crosses a line. This is people's children, families. This is impacting people still today.
Elizabeth Neumann.
I mean, you're right, Nicole. This is just more of the same. But if you go back and you remember that when he was sworn into office, it is abundantly clear that he came in with the purpose of pretending or playing the role of the president. And anytime he has to make tough decisions that are not things that he actually wants to work on or he doesn't want to do, he either, in a good scenario, might pass it off to a competent cabinet member or deputy and let them run with it. And there are some places in his administration where he has had successes, largely because he and his inner sanctum team at the White House don't touch it. Or you have a situation like with COVID, where for optics purposes, he had to appear like he's in charge. And the moment they set up that task force and they mandated that the public affairs all ran through that task force, which is not according to the way that the response plans are written. There's an entire emergency support function that's supposed to handle public affairs. Mm-hmm. That function was kind of set aside, and it was ran out of the White House. And the moment you put the White House in charge of this task force, because their goal is to play the role of the president, not to actually do any of the work of the presidency, the way they evaluate problems is entirely through the lens of public affairs, not through the lens of the oath that he swore to protect and defend this country.
You know, Elizabeth, the New York Times reporting we've been talking about implicates, I think, one of the most senior members of the vice president's staff, a man named Mr. Short. I guess my question to you is more personal. What propels people into service of the big lie that children aren't at risk? I don't know if that Mr. Short has kids of his own or not, but what gets everyone sort of in the whitewater raft tumbling down toward a big lie? And I want to play, don't take my word for it that it's a big lie. Here's Donald Trump telling Bob Woodward that it's a big lie, that kids are certainly at risk. Let's listen to that first.
Now it's turning out it's not just old people, Bob, because today and yesterday some startling facts came out. It's not just older young people, to plenty of young people.
So Donald Trump told Bob Woodward on March 19th, it's plenty of young people, but the New York Times reporting, Elizabeth, has Mr. Short helping to push the big lie that children weren't at risk. Why does that happen?
Yeah, I can't speak specifically to Mark Short, but I can tell you that from working with people in that environment, you might start off strong with a set of principles and morals and know what your red line is. And through a combination of getting beat down because maybe you spoke up in the past and you were beat into submission or threatened with either, you're going to lose your job, maybe on the best case scenario, or maybe they have blackmail on somebody. They are a very intimidating crew in the way that they demand loyalty. So you have that factor going on, and then you just have the factor that groupthink sets in, especially in year 4 in an administration, they start to actually believe the lies. So I don't know that anybody woke up that day and said, I'm going to just decide to not protect children so that I can get Donald Trump reelected. But they've kind of lost sight of what truth is, and they just are believing the lies that the president speaks from the podium. So I think it's a combination of those factors. I'm sure psychologists will have a heyday on the other side of this administration trying to figure out the Stockholm syndrome that set in for any number of people that walked into this administration with pure intentions and compromised a lot of their values in the process.
You know, Phil Rucker, I want to push on this a little bit. I mean, we know that Donald Trump knew it was a lie because he says to your colleague Bob Woodward on March 19th that it doesn't just affect older people. Young people can get it. Those are Donald Trump's words on a tape recording with a reporter. So he surely had to have been aware of that behind the scenes. And that predates the big political push where throughout the summer he was threatening to cut federal funding for schools that didn't demand in-person learning. We now tragically see upticks of infections almost everywhere that in-person learning is a thing. Tragically, in my own home state of New York and home city of New York City, it's happening right now. So tell me how they operationalize a lie that even Trump knows is a lie.
Well, Nicole, it's all about trying to present certain data elements to the public. It's one of the reasons why the president recruited Dr. Scott Atlas off of Fox News Channel to join him in the White House and to be the apparent face of medical professionals for this task force. Now we see him because he's taking the data, taking the facts, and sort of twisting it in a way that suits what the president wants to hear and what the president wants communicated to the public. But there's one other thing we should keep in mind with this whole discussion of whether young people get the virus, and it's that it's not only young people at schools. If it were, you'd have a whole lot of disciplinary problems, right? I mean, there are plenty of adults at schools, teachers in the classroom, janitors who are cleaning the classroom, the people making lunches, the principals, the sports coaches, the parents. There are so many adults who come, who interact with these kids at schools who are therefore at danger when the schools are opened and when the virus might be spreading. And that is important, and it's something that the administration has not really at all focused on in their public messaging during this debate.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.